Select your personal protective equipment. Perform hand hygiene. Apply your gown. And make sure you tie it in the back. Then put on your mask, goggles or face shield, and finally your gloves. To remove personal protective equipment, start by removing your gloves, goggles, gown, then your mask, and finally perform hand hygiene. After the patient leaves, perform hand hygiene and apply gloves. While handling the instruments, safely put them into the biohazard bin. Make sure the lid is locked. After, remove gloves and perform hand hygiene. Then take the bin to the dirty area. To make sure the used instruments are cleaned properly, to stop blood and body fluids from drying on them, put the instruments immediately in the undiluted Sklar soak, making sure all the instruments are completely covered, and let them soak for at least 10 minutes. Clean the biohazard bin with a super sani cloth, the purple top, and make sure it stays wet for at least 2 minutes. After soaking the instruments for at least 10 minutes, use the scrub brush to clean the instrument and get rid of any leftover product or blood. Rinse the instruments with tap water and put it on a blue pad to dry. Place one instrument and a chemical indicator in each self-sealing pouch. Make sure the pouch is big enough for the instrument to fit comfortably inside and the chemical indicator is facing up so you can see the results. If an instrument has hinges or moving parts, spray them with a water-soluble lubricant. Make sure you don't over-lubricate. Place an instrument with hinges in the open position and remove the backing paper and seal the pouch. During the first cycle of the day, use a process challenge device by sterilizing a biological indicator and a chemical indicator. If any indicator doesn't pass, treat all instruments in the load as not sterile and repackage and repeat the process. Put the pouch on the tray in the autoclave with the paper side up, making sure the pouches do not overlap each other or the tray. Place the process challenge device on one of the two middle trays, then choose the right cycle. The Lexa screen will show that the cycle is finished by displaying the word complete. Use a tray holder to take the pouches out of the sterilizer because they may be hot. Check for moisture inside and outside the pouch. Make sure the chemical indicators on both the inside and outside of each pouch are the right color. Also check the chemical indicator inside the pouch to see if it passed. If any indicator didn't work or there is moisture in the pouch, put it in a new pouch with a chemical indicator and sterilize it again. You don't need to clean it again before doing this. Put a label with the load number and the date on the clear side of each pouch. You could find the load number on the screen of the autoclave. The Attest Mini Auto Reader must heat up for at least 30 minutes before you use it. Start with a non-sterilized biological indicator called a BI. To activate it, place it in the activator and squeeze. Then place it into any of the chambers of the Attest machine with the color tab on the top. This is the control BI. Since this BI hasn't been sterilized, the result should be positive. Then, after allowing the sterilized BI to cool for at least 10 minutes, you can activate it with the activator and place it in another chamber of the Attest machine. This is the test BI, and since it has been sterilized, the result should always be negative. Also make sure the sterilized BI top changed to the correct color. If neither result as expected, treat all instruments in that load as non-sterile and repackage and re-sterilize along with a new process challenge device. Keep sterile instruments in covered cabinets or drawers away from moisture. Use the oldest pouch first by putting the newly sterilized instruments behind or underneath the older ones. Sterilized pouches don't have an expiration date and stay sterile until the pouch is open, punctured, torn, or wet. After each sterilization cycle, fill out the daily sterilization record form using the link or QR code. Enter your first and last name and the date and the location and sterilizer being used. Then enter the load number. Select pass or fail for the results of the internal and external pouch indicators and the results of the added chemical strip. If this is the first load of the day, select Yes and complete the biological indicator section. Otherwise, select No. When it's time to add water, use only distilled water. After unscrewing the cap, remove the ring so it doesn't accidentally drop into the tank. Once the clean water tank is almost full, you will hear an audible tone to stop filling. Once completed, check the screen to make sure it says that there is a sufficient amount. Clean the machine once a month or after 50 uses, whichever happens first. Start by taking out the trays and the chamber rack, and then the filters at the bottom by turning them to the left. Rinse the filters with tap water to remove any debris and place them on a blue pad. Using a microfiber cloth dampened with tap water, gently wipe the rubber seal on the inside door and the inside of the chamber. Be careful not to touch or damage the temperature probe inside. Use the same cloth to clean the outside of the machine. Wipe the chamber rack with a damp cloth. Then put the filters back in by turning them to the right. To put the chamber rack back in place, be sure to align the rack so that when you push it in gently, you will hear a click. Then gently pull to confirm it is in place. Finally, wipe the trays and put them back in the rack. On the home screen, go to Maintenance and then Chamber Cleaning to reset the cycle count to 0. Every year, or at 1,200 cycles, whichever comes first, perform the annual maintenance. Be sure to have the annual kit and a backup kit in case it is needed. Start by removing the rack and trays. Next, unscrew and remove the 3 chamber filters, followed by removing the door gasket. Finally, remove the HEPA filter. After dampening the microfiber cloth, wipe down the inside of the chamber, the inside of the autoclave, and the inside of the door. With the new kit, replace the HEPA filter, the 3 chamber filters and the door gasket. Be sure to have the door gasket slightly damp, making it easier to place. Start at the top and place the gasket in at an angle so it fits in place. Do the same at the bottom of the gasket, followed by the sides. You will feel it pop in place when done right. Take a moment to feel around the entire gasket to make sure it is correctly in place. If it's not, start again. The gasket must be properly placed or the autoclave will not sterilize correctly. Wipe down the rack and put it back in place. Remember, you will hear it click when it is in place. Wipe down the trays and place them back on the rack. On the main screen, select Maintenance, then be sure to clear the HEPA filter, the door gasket, and finally, the chamber cleaning by selecting the check mark to reset the count. To confirm each area was reset, select each one again to view the count as 0. Now it is time to document the annual maintenance. You will note the date, your initials, and check off all the monthly tasks and the annual tasks.